I practice neurology, board certified. Been here in Sarasota since 1993, actually. Prior to that, I did a fellowship at the National Institutes of Health in immunology and neuromuscular disease. And prior to that, I was doing laboratory work in, I did my residency in Cleveland at the Cleveland Clinic Foundation before that. And before that, I was doing neuroscience research at University of Rochester in New York. And I got my bachelor's in neuroscience with an emphasis in research at the University of Rochester. So I've been studying neuroscience since 1978. I'll be turning 60 in May. So it's been my whole life, neuroscience. And initially I thought I would be a researcher, a scientist, a bench researcher we call it, which means you're in the laboratory working at a bench. And it turned out that my early experiences in the laboratory were not as rewarding as working with humans. So I decided to become a clinical scientist, which is what I am. I do research. I try to think creatively in a scientific way about what we don't know and how we can learn more, while at the same time taking care of people. So I'm a clinical neuroscientist. And I fell into this cannabis thing because a lot of my neurology patients asked about using medical marijuana over the years. I had a lot of multiple sclerosis patients over the years, thousands actually, and they were using cannabis on their own. They figured out how it works for muscle stiffness. Migraine patients, patients with Tourette's syndrome, patients with different types of pain, which we'll be talking about tonight, all told me when cannabis becomes legal in Florida, they want to get on the legal side of using cannabis, even though they had been, many of them, self-medicating before that. So 2.5 years ago, when Amendment 2 passed, that was my opportunity to buy in fully with medical cannabis. And now my time is spent half of the day doing general neurology. I still see patients with Parkinson's and strokes and dementia, epilepsy and so forth. And then the other half of the day I do medical cannabis. I'm right here in Sarasota. And my cards and brochures are there, so if anybody's interested in coming in for a cannabis consultation, I'd be happy to see you. In Florida, in order to get medical marijuana, you need a card. You have to get a cannabis card. You have to be qualified, is the verbiage the Office of Medical Marijuana Use uses. Once you get your card for medical marijuana use, you can go to a dispensary and buy products. And that includes flower to smoke, like the old days, concentrates to vape or tinctures and topicals. And those cannabis preparations have a combination of CBD, cannabidiol, as well as THC, tetrahydrocannabinol. You know, THC is the active ingredient. That's the part that makes you high. But you don't need to get high, or you may not need to get high when you use medical cannabis, because small amounts of THC, not enough to cause a psychoactive state, but small amounts, oftentimes with CBD, cannabidiol, and the other molecules in the plant, work quite well for a variety of conditions, including pain, which we'll talk about tonight. So that's what I do. So there's that. And I wanted to let you know that I'm a clinical scientist, and I told you about all that schooling because I want you to believe what I'm about to tell you. You know, the problem with medical cannabis and cannabis and marijuana are basically the same thing. And the problem in the United States is that since the 1930s, cannabis has been prohibited. It's been illegal. And so there was a formal smear campaign against marijuana in the 1930s because of the social and political and industrial complex powers that wanted to demonize the bud so that brown people from Mexico would be frowned upon. You guys may know that. And then after Reefer Madness came aboard and all the craziness continued with the Nixon administration and the Controlled Substances Act, it became inculcated in our culture that cannabis was bad, marijuana was bad. And I still have to work real hard at educating, especially the older patients, that cannabis is not bad. It's actually a lot safer than alcohol, nicotine, and a whole host of other pharmaceuticals. So, you know, the main reason I'm here is to educate you, and I'm hoping that you will take the good word about cannabis and spread it to your friends and family and neighbors. Because within the next 10, maybe 15 years, I am confident that cannabis will be a medication that pretty much everybody is using to some degree on their own without the guidance of a physician. You will be able to go to the store and get your CBD supplement, maybe THC, maybe you'll have a mix of other terpenes, we call them, the aromatic molecules in the cannabis, in order to reduce anxiety when you get home from work. You don't have to have a gin martini. If you want to, you can, but using a small amount of cannabis to reduce anxiety and relax is much safer than alcohol. And you don't need a doctor's order to do that. You should be able to get it on your own, and you will. Because right now we have 11 states in the union that are adult use, also called recreational, where people can go and buy their cannabis without needing a doctor's order. 33 states total allow cannabis use, including the ones that are medical without the adult use laws. 33 states. So I'm confident that within the next 10, 15 years, you know, the cannabis will be descheduled. It won't be a Schedule I drug, which means that it's federally illegal. That's why it's so hard to do research in the United States. That's why you can't take your cannabis across state lines. It's not a good situation for the broad adoption of cannabis, but the trend is certainly there. And I want you to get a jump on what cannabis is all about so that you can, again, spread the word, and when the time comes, you can use it safely on your own without a doctor's guidance. And that's the way it's going to be, all right? So remember tonight, you know, Brennan's got this on video. We'll be looking back. And I think my opportunity to do work here is limited because after, you know, another 5 or 10 years, I think most people will know a lot more than they do now about cannabis. So, you know, why do I feel this way? You know, where do I come off saying this? And why am I passionate about it? Well, it's because there's a lot of science behind how cannabis works in the body. It's not a snake oil. It's not a simple sedative or euphoric-inducing drug. It's much, much more than that. And that is because of something called the endocannabinoid system. Say it with me. One more time. Endocannabinoid system. Thank you. The endocannabinoid system is a system of interconnecting functions in our bodies, just like the skeletal system or the respiratory system or the endocrine or immunological system. It's a system in our bodies. It's there. The endocannabinoid system is a combination of molecules, chemical messengers, enzymes that produce them and break them down, and receptors that bind them. That's what the endocannabinoid system is. It's in our bodies. This is completely separate from marijuana and cannabis. I haven't even gotten to that yet. That whole thing is coming. But the reason I'm passionate about this is because I never learned about this in medical school. You know, I graduated in '87, and the endocannabinoid system wasn't described until the early 1990s. It's still not being taught in medical school. Why? Because it's Schedule I illegal, and the medical schools will risk losing funding if they do federally illegal stuff like talk about marijuana. I'm going to try not to get too political here. But it's important that we all learn about this system because of all the neurotransmitter systems in the brain, the endocannabinoid system is the most prominent. You guys have heard about dopamine and how that's important for Parkinson's, and how euphoria and addiction are related to dopamine surges, right? And how serotonin is so important for mood. Patients that become anxious sometimes use serotonin receptor inhibitors so that there's more serotonin. Well, those serotonin molecules in the brain and those dopamine molecules in the brain, they have to bind to receptors. That's how the nerve cells communicate. It's a lock and key type of system. Well, the endocannabinoid receptors in the brain are the most, there's more cannabinoid receptors in the brain than any other receptor in the brain. What are those receptors doing there? What function do they serve? Why did we evolve to have an endocannabinoid system? These are questions that scientists around the world are trying to figure out right now. Why have people over the past 5,000 years used cannabis initially in Asia and then through India and up through Europe and across the pond? Why have people been using cannabis culturally for thousands of years to treat things like pain, epilepsy, all sorts of conditions? You know, the history of cannabis is extremely interesting to me, and it has been, I believe, proven through all these thousands of years to be a safe medication, all right? So when someone tells you that there hasn't been enough safety studies, just quote me and say, well, it's been used for 5,000 years, isn't that safety trial enough? And it is, even though it's not randomized control clinical trials, which is the, you know, that's the gold standard for medical evidence in the United States. And we don't have a lot of randomized controlled clinical trials in marijuana in the United States. Why? Because it's federally illegal. Nobody can do those studies. But they're being done in Israel, they're being done in Australia, Germany, Portugal, Canada now is legal. So we're getting more of those standard research results available. But 5,000 years of use in cultures with completely different reasons to use it, sometimes spiritual, sometimes medicinal. That's a lot of evidence right there. We call that empiric evidence, right? It's real world evidence. So what I'm doing now in the clinic is I'm seeing patients. I'm trying to give a cannabis recommendation, we call it, what type of cannabis to use, and figure out with each individual person what therapy is necessary to relieve their symptoms. Because not all cannabis is created equal. There's different levels of CBD and THC, and there's other molecules. There's different ways to take cannabis. You don't have to smoke it. We use tinctures, which are drops in the mouth. We use capsules to swallow or edibles out west. We use topical creams and salves, transdermal preparation patches, you name it. We've got it for cannabis. But which method of administration, what dose, and what amount of cannabinoids are important for someone with a certain type of pain? Well, we don't know, but we're figuring it out. And that's sort of the knowledge base that I bring to the patients that come into the clinic. You know, we go on this clinical research journey together, and we'll be publishing results, and we'll be sharing these results, and you can go to our website and learn more about certain dosing protocols and things like that. So the plant, marijuana or cannabis or hemp, the plant has molecules, THC, tetrahydrocannabinol, cannabidiol, and other things that bind to those receptors in our brains and in our bodies. They bind there, not because God put the plants there for us to use. Our own bodies have chemicals that bind those receptors. The same way that we generate endorphins when we exercise vigorously and we get that runner's high that people talk about. Those receptors in our brains bind those endorphins. That's endorphins in our bodies. But if you take opium or heroin or OxyContin, those opiates from the poppy plant originally bind to those receptors in the brain. That's how these opiates work. And they're highly addictive and dangerous. That's why we have this opiate epidemic. Those receptors in our brains that bind those opiate-derived molecules are also in our brain stem. And if you use too much opiates, it depresses the respirations. That's how patients die from opiate overdose. They stop breathing. Cannabinoid receptors are in the frontal cortex, in the cerebellum, Basal ganglia, I can throw out all sorts of multi-syllabic words, but they're not in the brainstem. So it is impossible to die from a cannabis overdose. No one in recorded history has ever died solely of a cannabis overdose. Does it get any safer than that?
Can you even overdose in Kevin?
Well, you can overdose, but you won't die. So, you know, if you do too much cannabis and you feel badly, you feel maybe paranoid or nauseous or too sleepy, that can be considered a form of overdose, sure. So the cannabinoid receptors live in the brain. They also live in the gut. There's cannabinoid receptors in the bone. The uterus is full of cannabinoid receptors, and women have been using cannabis for centuries to ease menstrual cramps, help with childbirth, and treat for endometriosis, but that's another topic, all right, Nicole? Another day. We'll talk about women's health. Okay, let's talk about pain. So pain comes in lots of different shapes and sizes, and some if not all of you may be suffering with a painful condition or know someone that is suffering with pain and has a specific interest in how cannabis can help treat pain. Let me just tell you how a neurologist thinks about pain. It depends where the pain is coming from. So, for example, if someone has a shingles eruption and then they develop a painful neuralgia or nerve pain from that rash, that's a form of neuropathic pain, we call it. If you have a pinched nerve in your neck and you have this terrible pain or a sciatica, that's nerve pain. It's the same type of thing. It's a dysfunction of the nerves. That's a neuropathic pain. So that's one type of pain. Burning, stinging, shooting, intense pain due to a problem with the structures of the nerves. One type. Visceral pain. You get bad cramps because you've got Crohn's disease and your bowel's in a knot. That's a visceral pain. If you have other issues with your colon or small bowel or your tube, I like to call it the tube because it's really just a tube, right? It starts here and it ends here. But it's long. It's really long. And really, we're all just tubes. I mean, let's face it, surrounded by a bunch of other stuff. Anything goes wrong with your tube, you can develop visceral pain anywhere along there. And that's because the gut itself is surrounded by muscles. And when problems happen there in the gut, whether it's from inflammation or muscle spasm, it's painful. It's not good. That's visceral pain. Musculoskeletal pain. Musculoskeletal pain is probably the most common type of pain. And that's the type of pain that causes a deep aching discomfort. And that can last for hours, days, even months and years. That's musculoskeletal pain. Why? Because the muscles and the skeleton, including the joints, have pain receptors. So if there's a problem with, let's say, inflammation of the muscles in patients with fibromyalgia or other inflammatory conditions of the muscles due to trauma, it hurts. That's muscular pain, all right? That's different than the nerve pain and the visceral pain. There's rheumatic types of pain, like rheumatoid arthritis, osteoarthritis. Those are different kinds of conditions that may come under the musculoskeletal heading, but in general, that has to do with inflammation of the joints and the tendons. Rheumatic disease, osteoarthritis. Cancer pain is a whole different category in itself. Patients with cancer develop pain as a result of the tumor itself, tumor spread, plus the chemical processes that go along with that cause pain. Multiple sclerosis patients have a special type of pain called spasticity, where they develop a painful muscle stiffness due to problems with the spinal cord or brain. And that type of spasticity pain is a deep aching stiffness that sometimes is punctuated by extremely painful muscle spasms that may last several seconds at a time and contort the foot or hand. And patients with spinal cord injuries have the same type of a problem. Brain injury patients get spasticity pain as well. The reason I'm taking you through that whole dissertation is because when patients come to the clinic, not just the general neurology clinic, but also the cannabis clinic now, it's important to determine what kind of pain they're having because the treatment is different. Patients that have chronic musculoskeletal pain need a different type of treatment than someone that has a neuropathic pain. Why? Because they need more long-lasting relief. Let's say you have headache pain, okay? Headaches, I should have added those too. Headaches can be muscle tension pain, right? Those are the most common. But the other type of headache pain we call migraine. That's vascular pain. Vascular pain occurs because the blood vessels have pain receptors in the wall. And when you get a vascular type of headache, that's a form of migraine. You get that pounding, severe pain. Sometimes you can even feel it in your temples. If your aorta becomes inflamed, you can get a vascular type of pain, or if you have a blood clot in an artery, that's vascular pain. So it's important to determine what kind of pain the patient is suffering from, and you all, as I said earlier, will be treating yourselves someday, and it'll be important to identify, well, I don't feel good, but why is that? Is it a cramping abdominal, visceral type of pain? Okay, that's fine. I need this type of cannabis remedy, as opposed to someone who's got migraines and they need to take a quick inhalation of a different type of cannabis therapy to get rid of that acute pain. That's the other thing. Is it acute pain or is it chronic pain? Another important distinction. Patients with acute pain need a different kind of cannabis therapy compared to those with chronic pain, whether it's cancer-related chronic pain or non-cancerous chronic pain. It's a different animal. Patients in chronic pain develop a whole constellation of other problems because they're suffering for so long. Some of you may know people that have been in pain for months or years. It messes with you. It messes with you. You get depressed. You become anxious. Sometimes you become hypersensitive to things. Even light touch can sometimes be painful. And that's because of what's called central sensitization. And then it's a central pain syndrome. It's a different animal, and it just kind of multiplies. So that's why patients who have lived with pain their entire lives are challenging to treat. Not impossible, just challenging, because that's a chronic pain syndrome as opposed to acute pain. The reason I wanted to, again, share all this with you is to basically spread education and dispel misinformation. Cannabis is very safe. We use it in a variety of ways, in administration methods, dosages, cannabinoid ratios, and so forth. And we can achieve great things, but we need to do that together because there's so much stigma out there. And it's really important for people to realize that they don't need to be on opioid analgesics to treat their pain. We get patients off of opiates every day. We have a very high success rate, approaching 90%. It takes months, but it turns out that opioid addiction can be effectively treated with cannabis because there's a part of the brain that controls craving for opiates. And the cannabinoid receptors are very dense in that area. Cannabidiol especially is effective for reducing craving in individuals who are addicted not only to opiates, but other substances like alcohol and tobacco. If you don't reduce the craving, then you can't really eliminate the addiction. You just replace it with a different addiction. And some of our friends in Tallahassee say that cannabis is another form of pill mill because we're replacing one intoxicant with another. But that is not true because we, as I said, are coming into a new age of self-administered therapy that's scientifically based. This is not just about relaxation and recreation. This is about real science and helping people with real medicine. Plant medicine, it turns out, is real medicine. I've had to accept that. And I was telling Paige earlier today that this is all new for me because, trained in the West, we're not taught to believe in plant medicine, but plant medicine works, and this is one beautiful example of that. And for the opioid crisis, I can't think of a better reason to use this type of therapy. And we've been quite successful, not just in our veterans, but in individuals who have suffered, trauma in their lives, and they have chronic problems as a result of that. So spread the word. I'm going to stop there and take questions. Thank you very much for your attention.
Neuropathy.
Neuropathy pain is a form of neuropathic pain, like that pinched nerve or that shingles thing. Neuropathy pain usually occurs in the feet. It can be caused by a lot of different things: diabetes, chemotherapy. Guillain-Barré causes nerve pain. You got that? So the answer is yes, cannabis can help with nerve pain if it's the kind that's tingling, burning, or stinging. Some people have a peripheral neuropathy condition that causes a loss of sensation, and their feet are kind of like blocks, or they feel like they're wrapped in leather. Cannabis does not really help with that, because that's a loss of sensation due to nerve damage. So the cannabis, as far as we know, does not heal those nerves and bring back sensation, but if you have that stinging, burning, tingling pins and needles type of thing, it does help with that. Sometimes topically, which can help avoid the intoxicating effects. You just put it topically. But some people need to take it systemically. So, yes.
You said helps veterans, but the VA doesn't deal in cannabis.
So the VA's position on cannabis is this, and they changed it recently. The VA supports veterans learning about cannabis and using cannabis, but the VA can't give them information about it. The VA doctors can't recommend it, and no cannabis-related services can be provided on VA property. And of course, cannabis cannot be used in active military, because that's a no-no. Department of Defense, there's a zero tolerance for cannabis. But talking about veterans, they support it. They just can't administer it or encourage it. I went to the VA office on Bee Ridge Road not too long ago with my brochures in hand. And I was like, my dad goes there. And I was like, can I just talk to the doctor? They wouldn't let me in. They wouldn't let me in. They wouldn't let me even leave my literature. So I went to the SRQ Vets meeting instead. So yes, they can use, but not through the VA.
That would not affect my status with the VA at all.
No, you do not lose any benefits. And that is at the VHA, Veterans Health Administration.gov website. I can send you the document. They don't have to know, but you would not lose any benefits.
So does it decrease inflammation?
Yes. Cannabis is a potent anti-inflammatory. Not just THC, tetrahydrocannabinol, the active psychoactive ingredient, but CBD, cannabidiol, is a potent anti-inflammatory. So CBD works quite well for inflammatory conditions that are triggering pain. It also reduces anxiety. It's good for epilepsy in children, so yes.
So the ratio, is it good to do like 1-to-1, or does it just depend on?
So the ratio you're referring to is the amount of CBD and THC. So if you have a 1-to-1 ratio, I'm just letting everyone know, that means that the preparation you're using has equal amounts of milligrams of CBD and THC. That's 1-to-1. So if you have some experience with cannabis, with the THC intoxicating or non-intoxicating effects, the psychoactive effects, then you can use 1-to-1. That's fine. I use 1-to-1 a lot in my patients. But if you're naive to THC and you haven't used any marijuana or cannabis, sometimes I'll start with like a 20-to-1 CBD to THC, because I don't want people to feel impaired and scared.
I guess it's for sleep more, that the 1-to-1.
So for sleep, sometimes you need a higher THC, right? But that's not an inflammatory condition. So you're asking me two questions.
Yeah, I just figured out that I was using it for sleep, the 1-to-1, but not, I don't like to be that medicated for the inflammation pain part.
1-to-1 is good for inflammation during the day as long as it doesn't cause impairment. And then, for a lot of patients, they need a higher THC to help with sleep at night. And it doesn't matter if you're impaired because you're sleeping.
Right,
You have your card already.
yes. Well,
Are you one of my patients?
I'm from Michigan.
Oh, you're from Michigan.
That's my parents.
So I had my card.
Oh, really?
Yeah,
Okay.
so I'm visiting here.
All right, well, you get a free consultation, all
Oh, thank you.
right?
Thank you.
Because you're connected. So just take my number, give me a call. Yes?
Are there drug interactions?
Yes, there are. There are drug interactions. Cannabis is metabolized by the liver. It does not cause any liver damage, but the enzymes in the liver do metabolize the cannabis. And so other medicines that use those same enzymes, we call them the P450 enzymes, there is some potential interaction. So for example, if you're on Coumadin or warfarin, which is a blood thinner, and then you start cannabis therapy, you have to be careful that the cannabis doesn't throw off the anticoagulant effects of the Coumadin. If you're on a antifungal therapy called diflucan, it can cause a problem with that as well. But usually, the doses of the cannabis that we use for general medical care are not high enough to cause a problem. Only at very high doses of CBD, I'm talking like thousands of milligrams a day, do you have to start thinking about the P450 enzymes. Most patients with CBD, they get away with 20 to 100 or 200 milligrams a day, and it's not a problem. Thank you for asking that question.
Question. So if do I become like a patient of yours as a neurologist and then marijuana treatment? How does that really work?
If you need cannabis therapy or you're interested in exploring cannabis therapy, you don't have to be a general
I
neurology.
need a new neurologist anyway, so
Okay.
will it work hand in hand?
They're hand in hand but separate. So you would come to the neurology clinic, and it's like a regular doctor's office visit. We bill your insurance, and we sit in one room.
Okay.
And then in the afternoon, we do the cannabis consultation in my office at my desk. I do the registration that's required to help you get the application started, and I would guide you with the cannabis therapy there, and I would take your money but not accept your insurance.
Okay.
Because no insurance covers
Right.
cannabis therapy. Why?
So she wants to know.
So, but make appointments together, back to
But
back.
how,
Yeah.
not only that, will you be treating me? Okay, I'm your patient as a neurologist. However, the treatment that you're providing me, or the recommendations, will be part of that treatment, neurology treatment. Do you understand what I'm saying?
Yes, so there will
Like,
be...
for example, I'll disclose, I have migraines. I suffer from chronic migraines.
So we would sit down in the general neurology visit. I would take your history. I would examine you. We would talk about treatment options and then decide if cannabis is right for you.
Okay.
And oftentimes, in situations like that, and I have a lot of patients that are part of both of my practices, like Parkinson's, for example, and so forth. Oftentimes, I'll keep those patients in both practices, and that's what we call integrative medicine. Integrative medicine is the mindful use of conventional, primarily Western medicine, and more unconventional, although evidence-based, alternative therapies. That's integrative medicine. Homeopathic is just mainly the alternative part.
Does it work for restless leg syndrome?
It does. And the reason it does is because in restless leg syndrome, the nervous input to the muscles causes increased muscle tone. And the cannabis works really well for reducing that type of muscle hyperactivity, especially since you're going to use it mainly at night. Some patients with restless legs have problems earlier in the evening, but most people have it beginning at night, and then it gets earlier. Because you
All day.
you have it all day? So you've had it for...
It's my roommate, he does this all
Yeah,
day.
So yes, it does work for restless leg syndrome.
Is that a qualifying condition?
So it's not, but it is. So it is and it isn't. And let me just, that's a great question. So in Florida, in order to get cannabis therapy approved, you have to have one of the qualifying conditions, which is a list of about 10 conditions, including multiple sclerosis and cancer and HIV, glaucoma, things like that. But there's one of the conditions at the bottom that qualifies you is a condition similar to one of the conditions listed above. So for example, patients with multiple sclerosis have muscle spasms and spasticity. So if you have a condition like that, I can qualify you.
I get cramps where my hand just doesn't work, and it gives me one of these.
Like a writer's cramp?
Like that, and sometimes in the legs.
You do?
Yeah, and I served in combat, and I never leaves you.
You never?
It never leaves you.
PTSD.
Oh, you have that. You mean?
Yeah, well, yeah, it never goes away. Does that
Is that covered?
So the cramps and the psychological aspects may be separate or they may be connected. So we would have to talk about that.
But is that one of the qualifying?
PTSD is one of the qualifying conditions. And I just want to expound on that just a little bit. One thing that cannabis does really well is it helps people forget. And the problem with PTSD has to do with intrusive memories. People can't forget. They relive their trauma, they're hypervigilant, they're anxious, they have trouble participating sometimes in social situations because they can't forget the trauma. What does cannabis do really well? It helps you forget. It's like that movie, Dude, Where's My Car? It's important to forget. If you didn't forget, you would be overwhelmed with the amount of information your brain is trying to process every day. Think about it. You know, if you don't filter the amount of information out that's not important to you, your brain would explode. Not really, but sort of. So it's very important. Forgetting is a very important normal function of the brain. We have to compartmentalize memories into what's important and what's not. We create long-term memories from our short-term memories that are important, and then we have to deal with long-term memories that are traumatic in a way that creates mental health. And if there's a problem with that, cannabis is extremely helpful for that.
I'm qualified or certified? Qualified?
You're qualified.
No, not here.
You have
in Maryland.
Okay.
And I was at the Vegan Fest a couple of weeks ago, and there was a table of somebody else, Medwell, whatever, and they told me the process to go through here. You don't have reciprocity, but it was a release form to get my records from Maryland, and that whole process, whatever.
Okay.
So now I'm wondering, because it was through a psychiatrist in Maryland. So would that be, I mean, I have other conditions. I feel osteoarthritis now. I have very stiff hands, but my records are from a psychiatrist there.
It's fine.
How does that work?
You come to the clinic. You just come in. If you have medical records with you, that would be helpful.
Well, I don't yet, so can I use that form to send them to you?
Yeah.
They have, I think
It's,
paperwork has their information on it. So
we can help you. We can help you. One of the advantages of having a general medical practice in addition to being a cannabis doc is I have all the infrastructure in place to help patients get their records. We can get them for you.
So is that something I should start now before making an appointment, or make the appointment and get the records going now?
Make the appointment. Call Chanel tomorrow, 941-400-1211. Call Chanel tomorrow,
Is it on your-
and she'll tell you what to do.
Okay, great.
It's on the card.
Everybody has a card.
If somebody already has a medical marijuana card and they come to see you as a patient
For general
for
neurology.
general neurology, can you eventually not transfer their card? I know you have to start all over again, right? The process.
For general neurology patients who have their card with another physician that want cannabis guidance from yours truly, you have to switch to our cannabis clinic.
That's what I-
And that's a simple process. You just come into the office, we go on the computer and switch you.
Oh, okay.
And then your card and your cannabis orders will be, my responsibility.
Right,
Right.
okay. So that's the best way to do it, is just to make it a general appointment.
Yep, you can make it, well, you don't need a general neurology appointment to switch cannabis clinics.
But what about the physical and all of that? That would be a good to have.
If it's an involved neurological condition like you were mentioning earlier
Yeah,
tonight,
Traumatic brain injury.
it's probably better to do a general neurology appointment because that's a little more complicated.
That's what I was thinking. Do you have a protocol for TBIs, or is each one is, so you do?
I have some guidelines that I use that I've learned about from other practitioners that have been doing it longer than me. I work with a team of docs out in California that have been doing this since, well, actually they're from Israel originally, and then they went to California, and so I have their treatment protocols. So yes, the answer is yes.
Good.
We have protocols.
Okay, thank you.
And is there a charge to switch the card to you?
Well, there's an annual charge that we charge patients each year, and so that would be the charge. It would be the annual charge. So if you have time left on your old card with your old doctor, we don't credit you for that. Once you switch, you start new with us.
It's like a new card.
Well, the card itself, you have to register with the state. And that has an expiration date, and you have to pay $75 each year to the state. So you don't need a new card, but you need a new doctor.
What benefit do you see with your Parkinson's patients?
Several benefits in Parkinson's. Cannabis reduces tremor. I'm watching you, I got you. And it reduces muscle stiffness, because patients with Parkinson's sometimes have rigidity of the muscles. It doesn't help with their balance, though, so you'll still fall backwards if you have that problem. It also helps with Parkinson's sleep disorder. Patients with Parkinson's oftentimes have a problem with sleep, and it helps with that. So it's muscle stiffness and tremor and sleep, and also it helps with mood, depression, anxiety, things like that.
The tremor, is that a universal, or is that on an individual basis, the help?
Well, it helps most patients. I mean, this cannabis medicine doesn't work 100% of the time in everybody. But in most patients with Parkinson's, we can achieve some benefit. Is that what you were asking?
Yeah, I obviously have Parkinson's, but tremor is my biggest issue. And I use cannabis, but primarily only in the evening because I don't want the psychoactive during the day. But the tremors are dominant during the day.
So the question is, in order to reduce tremors during the day and avoid the psychoactive effects, can you still use cannabis? The answer is yes. You just have to use the right ratio of CBD to THC so that there's not too much THC and you can get the benefit. You can try CBD alone, and I believe there's some CBD products on the other side of the wall, right here.
Hundreds.
So you can try that.
Samples afterwards if anyone wants.
Okay. And just by the way, just to put a point on that, before I agreed to even come here and do this, I had a chat with Nicole about the products that she has here and what kind of analysis those products have been through to make sure that they're clean and reliable, because it's a little bit of a CBD jungle out there. You know, many of the CBD products that you'll find on the open market, whether online or in some gas station, are not represented accurately by the label. In fact, I've seen studies where there's significant amounts of THC in the CBD-only products that some people are selling. And some of those products have zero CBD. So it was super important for me to partner with a reliable vendor, and I thank Nicole for inviting me here and being part of this. But you know, the products here are quality, and they're very reasonable, and I think that they help a lot of patients. CBD is a wonder drug. That's why it's exploding around the world now, because it works. It works for inflammation, and it works for anxiety, and it's super safe. So it's definitely worth trying if that's something you're interested in.
Is a prescription strength better than what?
So the prescription
Of CBD.
CBD. So if you get your cannabis card and you go to a dispensary and get your CBD there with 0 THC, is it better than the CBD you get here?
Stronger?
No.
No.
Milligrams of CBD are equal. Nicole, do you have a comment?
Yeah, I was going to say, that's important for people to know that molecules of CBD are molecules of CBD. That's where we get a lot of people that come in here while they're waiting for their card or to counter the psychoactive nature of the THC from their medical marijuana or medical cannabis.
Yes.
It's from hemp.
So let me describe to you the difference between hemp and marijuana. Cannabis, the plant Cannabis sativa, was described by this botanist named Linnaeus in the 1800s. And what it means is that that plant that migrated from Asia down to India and all around is a cannabis plant. It's Cannabis sativa. It's cultivated cannabis. That's what that means. In India, they created a certain breed of cannabis that was very sedating, and that was called Cannabis indica from India. So Cannabis indica was brought by this physician, O'Shaughnessy was his name, to England, and he treated the Queen for her migraines with Cannabis indica. And it became a very popular remedy for a variety of conditions. So the Cannabis sativa and Cannabis indica is all part of the cannabis plant. Now, the cannabis plant that was used for industrial purposes, that did not cause intoxication, did not have that psychoactive property, and we called it hemp. But it's the same type of cannabis plant. The stalks are a little longer. The flowers on the top don't have the same type of THC in them. But it has CBD. So the only difference between marijuana and hemp is the amount of THC. Okay? That's it. They're both forms of cannabis. That's why we are Neurology of Cannabis. That's the big category. And then you have hemp, which is used mainly for industrial purposes, or CBD. But you can't have THC in the hemp, otherwise it's called marijuana. It's so confusing.
Well, there's a tiny bit.
0.3% or less
Yep.
is our legal limit.
Yep, it's kind of arbitrary. Yeah. So, so growers in Kentucky and around the country are trying to grow hemp with less than 0.3% THC. But if it turns out to be too much, 0.4%, sometimes those crops have to be destroyed. And if someone is planting high THC plants like a mile away, that could mess up the hemp grow. I was just learning about. So it's all about how much THC and how much CBD is in it. The CBD derived from hemp, the molecule, is exactly the same as the CBD molecule derived from a marijuana plant that has a higher amount of THC. CBD is CBD is CBD. It's a molecule. It's all the same.
Would that be good for spinal stenosis with radicular pain?
Radicular pain. You're in healthcare, aren't you? Nobody says radicular pain if they're not in healthcare. So CBD can help with pain, yes, and inflammation. So it is worth a try.
Is it better to do with the little marijuana in it for the pain relief, or not?
So it may be, but it may not be. If you want to try CBD first, I think that's completely reasonable. And we see a lot of patients that have tried CBD and they get some relief, but they need a little boost. So we give them a little THC through the legal clinic that we have, that whole thing, and they notice a difference. But there's so many people out there that are getting relief with CBD without THC. So it may be worth a try. Sir.
Walk us through, because I was reading some of the information on Columbia Care and what's provided under the program, but if I was to come to you and say I want to try this, for a year is usually the period, and over that time you're going to try and tell me how I'm going to get rid of my chronic pain, and you're going to adjust up and down until we find. Can you explain a little bit about how it works?
So you would come into the clinic. We would get you registered and qualified so you can go to the dispensary and get cannabis therapy. That has different amounts of CBD and THC plus terpenes, which terpenes are, don't get me started on the terpenes. Terpenes are the aromatic molecules, and they have biological effects too. So we would get you started on a product and a protocol to help you with your pain. Most patients require between 4 and 8 weeks to reach a therapeutic level where their symptoms are improved, because you want to start with a low dose to avoid side effects like drowsiness and so forth, and then you work your way up depending on your tolerance for THC. And then through adjusting the dose and so forth, we can usually get you there in a couple of months. But the fee that you pay our clinic is for a year, is an annual fee. The card you get from the state is an annual card. So the other cost is actually buying the medicine. So does that answer your question?
And you take that medicine, whatever it is, at your home or outside the clinic, correct?
Correct. So the question was, how does it all work? And so you come to the clinic, you get your card, you get your recommendation, we call it, and then you go to the dispensary and buy your products there. For example, at Columbia Care you mentioned. We don't touch the plant. We don't sell any products. For me, that would be a conflict of interest. And so I don't do that. It's illegal for me to do THC, but I don't want to sell CBD. I just do my thing. And so you would go get your products from a dispensary like Columbia Care, you're holding their folder, and then you would take it home and you would experiment. Remember, we're all clinical scientists, we're all in this together. I started by saying this is going to be a patient-directed treatment that you all will participate in within the next 20 years. I'm confident of that. So you would seek your own level, sir. You would figure that out on your own. I would provide guidance.
And once you pay that $250 fee, there's no further charge for the guidance for that year.
Correct. You could call or email as many times as you like. I won't answer and I'll ignore you, but you can call as many times as you like.
So once you're set up with your card and your recommendations, when you go to the dispensary, is there anything stopping you from getting something else besides the recommendations of the doctor?
Thank you. So the question was, if you come to the clinic and you get your orders to go to the dispensary, can you still choose what it is you want to buy when you get there? And the answer is yes. You have the freedom. That's the way I do it. Not all cannabis doctors do it that way. What I like to do is I like to give a lot of options to the patients so that you can go back and forth to the dispensary without checking with me and adjust your own therapy.
Thank you.
You're welcome. Sir?
It sounds like from some of the things you said that there is no watchdog organization that looks at the quality of the products that are being dispensed. Is that true? There isn't the USDA or somebody that looks at the quality of things?
So the question was, who's monitoring and regulating the quality of the products that are sold at the dispensary? And the answer is, in Florida, the Department of Health and Department of Agriculture watches very carefully. So in Florida, the dispensaries are actually owned and operated by the growers. So it's vertically integrated. In order to get a license to grow and produce cannabis products, you spend a lot of money, you go through a lot of regulatory hurdles, and then you become a license owner. You grow, you manufacture concentrates or capsules or whatever, and then you also own and run the dispensary. And those products, through that whole pipeline, are highly regulated to make sure that they're not going to harm anybody. For example, most of you probably heard about the vape crisis, where around the country, young people primarily, but not only, have been dying from pulmonary illness associated with vaping medicine through cartridges that are sold on the black market. And we believe that those cartridges are tainted with a variety of problems like vitamin E acetate. There's an anti-mold pesticide called myclobutanol, which converts to hydrogen cyanide when heated. People are creating these cartridges and putting cannabis medicine in them in their garages, selling them, and people are buying them and inhaling that medicine in an unregulated risk way. That is not what's going on in Florida at the dispensaries. The dispensaries' products are highly regulated. My own wife has her card. She vapes. She helps her with her sleep. Hi, Joyce. Any other questions?
How long does it usually take to get registered, get your card?
10 days.
What percentage of your patients are at what age level?
So the question is the previous question was, how long does it take to get your card? It's approximately 10 days from the time you come into the clinic to get your approval from the state. And then you can go get your medicine. The other question was, what is the average age of my patients? I think the average age is about 60. I have a lot of patients that are older because they know me from my neurology clinic and they have Parkinson's or epilepsy, Tourette's, multiple sclerosis, and so forth. But I also have a lot of younger patients with migraine and other conditions. And then word of mouth, people are coming. But I think it's a little younger than the overall demographic in Sarasota, which is becoming a little bit younger, actually. So 50 or 60, I would say. So this gentleman had a question.
Yeah, it's real quick. A young person with, a young person is 47. Used to be young. Anyway, he's got a TBI, and his short memory is really bad. And you're talking about, one of the things I still remember from the Cheech and Chong movies and stuff is forgetfulness and also a paranoia that sweeps over. Is the medical marijuana, is it with a traumatic brain injury, is there a problem with that perhaps?
So the question was, in individuals with traumatic brain injury, can medical marijuana make you worse? For example, by
as far as the short-term memory
causing problems with memory. So yes, if you don't use the right type of medical marijuana or cannabis, and you don't use it in the right way, it can make you worse because it can cause sedation and forgetfulness and trouble with functioning if the dose is not correct. So, or if the product is not correct. Back in the day when people that I went to high school with were smoking marijuana, you didn't really know what you were getting. Whatever you got. And sometimes you got something that made you paranoid, and sometimes you didn't. And that's because of the difference in the way these plants are created. Some plants are more likely to cause paranoia than others because of these terpene molecules I alluded to earlier. The terpenes are molecules that determine, at least historically, what was sativa and what was indica. And sativa was more likely to cause paranoia, and indica was more likely to cause sedation. But it's not like that anymore because all the plants are hybridized now. And the way we look at plants is by what's called the chemovar, or the chemical variety. So when I look at these plants and I make my recommendations, I choose chemical varieties that are not likely to cause memory loss or anxiety in individuals who are predisposed or at risk for that. Mm-hmm. And we choose chemovar products, marijuana products, that are appropriate for the type of symptom you have. Mm-hmm. So yeah, it's individualized medicine.
Okay, thank you.
Thank you for asking that.
So doctor, you're a medical doctor, so you're licensed to practice medicine. Is there some separate license or certification to do the cannabis side of your practice?
So the question was whether or not there's a separate qualification that the doctors have to go through to have the privilege of writing cannabis orders. And the answer is yes. In order to be a physician that recommends cannabis in Florida, you have to be either a medical doctor or a doctor of osteopathy, a DO, or an MD. You have to take a course online That's only 3 hours, super simple. Pass that online quiz, and that's it. And then you can be a qualified doctor. So currently there's about 1,500 qualified doctors in Florida, but only a fraction of those are really practicing because it's not as easy as it seems. So a lot of docs will do the qualification, they'll do the 3-hour course, and then they're like, well, what do I do now, you know? So there's that. Okay, well, I'm going to end there. Thank you very much. Thank you, Nicole, for having me. Appreciate that. Good night.